Again. Apologize for the technical difficulties. I'm here. It says they're telling you guys that I'm here. I apologize. I really do. There we go. Welcome, everybody. Thank you, thank you, thank you. All right, Gabby, hear me? Please give me a thumbs up if y'all can actually hear me this time. Okay, can
Check
y'all
one,
hear me,
check two.
Gabby?
I can hear you. Can you hear me?
I can hear you. All
Okay,
right,
so
let's
now we
see.
just got to get Michelle back.
There, okay, I see she joined. Waving at you. Oh, yeah, you can hear me. Thank you, thank you, thank you, thank you, thank you. Woohoo! Thank you so much. All right. So Michelle, if you can see us, hear us, send us the request. There. Bing. Bang.
I don't know why I just don't like us like
Drum
this.
roll. Drum roll. It's coming in here. There it is. Boom.
Can you hear me?
Yes,
Boom.
Wow.
we got the
Woo.
1, the 2, and the 3.
Ah. Whoa.
Happy Black Maternal Health Week.
Happy
Woo.
Black Maternal Health Week.
Look,
Yes.
I had to show up. I had to show up with my one of
Oh,
my
I didn't.
prized possessions, my hoodie from visiting one of my many pilgrimages to see the mothers. And so everybody who's joining us tonight, let's have to take a moment of deep appreciation and gratitude for my sister Michelle Browder, who is just a treasure, and the way that her talents and her gifts have breathed life um, back into the story, and breathed so much soul and so much spirit back into the lives and the legacies of Anarcha, Lucy, and Betsy, who, if you were not familiar with, you're going to learn a little bit about tonight. And I'm just grateful for you as an artist, as a friend, as a leader that does everything in your own unique, special way. And it's so beautiful.
Thank you.
And it's such an honor to know you and to have, just been able to just have you as a just a such an amazing, comrade on this journey.
Thank you. Thank you so much. I really appreciate that. Where where you want me to
Right. No, like no, and
we
so
gonna
and so
ride it, we're gonna rewind
right.
it. We're gonna wind
We're
it
gonna
all the way
rewind. So
back.
here's
Yes,
what
run it back.
here's what I want to do is, I mean, just
Mhm.
very, very briefly, just setting the stage about who the mothers of gynecology are. But beyond that, Michelle, what I really want to hear from you, because I know we know their story, but just I think it's important just to share with folks a little bit about what drew you to their story.
So what drew me, first of all, thank you for a wonderful weekend, Black Maternal Health Kickoff with you and Gabby and the team. It was so awesome. And my team enjoyed it. So thank you for allowing us to come and bombard your parking lot.
So great.
But what brought me to this, and I want to preface this by saying that your story and Kiara's story really kind of uplifted my journey towards
Mm,
when I started doing this work later on. But what got me was, I started learning more about Anarcha, Lucy, and Betsy when I was just 19. I was
wow.
only, 2 years older than Anarcha, who was 17 at the time, or, during the time of her experimentation and sterilization. But I was just 19. There was a postcard of this Robert Tom painting that you all have seen,
Hmm.
the black girl on the table. And I saw
Yep.
that when I was like 19 years old at the Art Institute of Atlanta. It was on my professor's desk,
Mm,
and I asked him about it. I was intrigued because, my parents were like Black Panthers. They taught us how to be, black
yeah.
entrepreneurs, and taught us the African diaspora and all that wonderful stuff, and told us what things were about. And so when I had not
Mm,
heard the story about Black girls and Black women, how they were sexually trafficked and used as medical experiments. And so when I inquired about this, my professor said, "Why don't you go and figure it out?"
Mm.
And, I like to fight. So I said, my father always told me, prison or art, you pick. And so what
woo,
happened was I decided
woo.
to go to the shrine. Y'all are in Atlanta. You know about the Shrine of the Black Madonna.
Absolutely.
I was a kid.
Institute.
Went there, told the
West
gentleman,
End.
yes, yes. Told him what I saw. I described the painting, and he sat me down for 2 days. To this day, I don't know who that man was, but he told me about the African diet. He told me everything. Just, he was like, and what are you going to do about it? And I was like, wow, I was intrigued. So I go back to college, Art Institute. My final year, I created my whole portfolio to honor these three enslaved girls, Anarcha, Lucy, and Betsy. And my professor took one look at my portfolio and said, your portfolio is too black.
Mm.
You need to stay here and diversify it. I'm not going to allow you to graduate. And so I decided to drop out of college. And here we are, 2 years later.
Oh my God.
Well, clearly black don't crack. And
Well,
will you
thank you.
tell and will you tell the people then where is today, what you're doing? And then also give the history truly, because you are able to bring to justice. And this Black Maternal Health Week is rooted in justice and joy.
Mhm.
And as tragic as that story is, you truly have brought joy and justice to them. And so
Mhm.
I would love for you to share that with our followers, because I don't think many people really understand it. And also where you're at, where you're located, how can people see you, how can people join in, because the work you're doing truly is historic and monumental, and we have to lift you up as a community, because although this is Black Maternal Health Week, Black
Yeah.
maternal health, Black women, we are every day and we are everywhere.
Absolutely. Thank you for that. Yeah, no. So during COVID, I ain't got no main. I ain't got no cheering. So I found myself in the house talking to myself. And we have this horse farm, which you all have been at the horse farm.
Yes.
Yep.
So I decided to go out and I started talking to one of the horses, literally, y'all. And I was like, how am I going to live? You don't work, you don't eat. I have a tour company, right? So I said, okay, I'm talking to the horse, and I swear to God, I said, Red, what am I going to do? I swear, if you would told me that horse did not tell me this, he turned around and said, I don't know, but you figured it out. So I was like, okay. So I started revisiting my artwork. Long story short, I started revisiting my art from when I was like 19. And I said, at no other time in my life will I have the opportunity to build a monument to these three enslaved girls. So Anarcha, 17 years old, at the time when she was pregnant, her owner took her to J. Marion Sims, downtown Montgomery, Alabama. New doctor opened up a Negro Women's Hospital, that's what it was called, in the backyard of his office so that he could experiment on enslaved girls that had developed a vesicovaginal fistula, which is a hole that would render them incontinent. So feces, urine, constant flow. And so basically, slave owners would bring their chattel, not human, but their chattel, to Sims so that he could operate on them. Because what were they doing? They were replenishing the stock. 1808 transatlantic slave trade is outlawed. And so in my state of Alabama, which it wasn't even a state at the time, but 1808, we had some 40,000 enslaved people, men, women, and children in the region. By the time the end of the Civil War, 1865, we had 435,000 enslaved men, women, children. Where are we getting them from? We're breeding cattle, human chattel slaves.
Oof.
So basically, these
Oof.
girls, their
Ah.
job was to breed human commerce chattel enslaved humans. And that was Anarcha, Lucy, and Betsy. Anarcha was enslaved in Montgomery, Alabama, the tallest one. That she's the tallest monument. 17 years old, 30 surgeries, unanesthetized. Then you had Lucy, who was actually from the Tuskegee area or enslaved in that area, and then you had Betsy, who was from Lowndes County. And basically, their owners, their enslavers, brought them to Montgomery so that Sims could try to fix the fistula that many of them malnourished, um, you know, raped. And so this fistula, it has a lot to do with the malnourishment, but also prolonged childbirth. And so hence, you get your speculums, all of these gynecological tools and procedures. from these girls, and it's upwards to 23 of them that we learn. So yeah, it's a quite unimaginable story, but it happened. And so at that time, I just decided that I would honor them with a monument in downtown Montgomery, Alabama.
And but Michelle, you haven't just honored them with a monument. You have literally built. You have institution. You have the mobile museum. You now have the RV. Can you tell people about all the things that you have and
Mm.
how they can come honor your work and this history in person?
Well, it's interesting that you asked that question because this is where Kiera and Charles come in. So after I erected the mothers, I flew out to San Francisco. I learned how to weld from some burners. Now I thought I was gifted, but those folks are like on a whole nother level when it comes down to art and creating massive monuments. And so I went out, learned how to weld for like a month and a half. Came back to Montgomery, Alabama, finished my project in 9 months, like I had a baby. And I reached out to Charles. You remember this, Charles? And I said, I don't know you, but your story and what happened to your wife was one of the reasons why. As a matter of fact, I had her name carved out and I had it setting up on one of the mantles in San Francisco as I would weld, and I used that as my inspiration to finish this project. And so basically, the mothers, they were erected uh, by the end of the year, September 21. And I was telling my staff and my friends, I was like, listen, we need to have a conference where we can invite people to Montgomery to learn about this history, because this is something that, medical practitioners aren't told. They don't know. Right. And so I said, wouldn't it be amazing if we can go to the actual site that's in the painting that was painted by Robert Tom, and go to the site where these girls were enslaved and used as experimentations? I called the gentleman who owned the building, and they said, Michelle, just go down to the site right now. And I go to the site, and there's this tall white man. And when he turned around, y'all, I nearly pissed on myself. The man looks like Mike Pence, and it was during the time when your boy was running for office, trumping him. And when he turned around, I was like, oh, here comes this Proud Boy. He's not going to allow me to do this. Um, and as I began to tell him what I wanted to use the space for, he says, oh, well, you could do that. Because I don't mind you doing that. And he says, well, I'm sorry, Miss Browder, I thought you were here to buy the building. Boom. So I was like, the building is for sale. The site where Antarctica, Lucy, and Betsy and these women and men
Ah,
were
y'all need to hear
experiencing
this
it,
story, man.
right? And
Y'all gotta
so
hear this story.
he was like, yeah, the building is for sale. I said, oh, okay. I said, well, what are you selling it for? He said $100,000.
That's it.
And I was like, but it's right around the corner from where the slave warehouses, right around the corner where they were auctioned off, right around the corner from 100 years later, from Selma to Montgomery, and where 11 states came to secede from the Union. What do you mean this is like historical space? He was like, Miss Browder, if you tell anybody, I deny it, but there's paranormal activity happening in the building. So I was like, well, what is it? He was like, you can hear children crying. There's a black woman that shows up, right? And he said, it scares the hell out of my people. He said, so I've decided to close the building and I want to sell it. And I said, I think I need it. He said, what would you do with it? And I told him, doulas, midwives, I'll teach this history. He was like, Michelle, this is a wonderful idea. So I bought the building, but he went from 100,000 to 35,000. I called up Charles Johnson and I said, Charles, you remember this? I text you, or not, I didn't text you, but I Instagram. And a friend of mine, her name is Dama Riles. She says, you need to reach out to that guy named Charles Johnson because, his story is so impactful. I was like, girl, I'm already carrying his wife in my, you know. And so you responded. I said, do you mind if I use Kiera's face in the space, like in on the window? And you said, absolutely not. I don't mind. And you actually came. You remember?
Yep.
Put your hand on the belly. And it was just from there, we've been growing now. This was our fifth conference. We had over 300 and some odd people that showed up again this year. We went to Birmingham. We talked about the historical significance of Birmingham and doctors and having your own insurance and having doctors who care about you, dignity, empathy, respect. And it was just been an amazing journey. So that's what brought me to where we are today. So now I'm sitting behind and in the space of where our first teaching cohort will be here tomorrow, where we're teaching students from University of Michigan, Jefferson University, UCLA, Public Health. People
Yeah.
are coming here to learn. So there it is. I know that's a lot, but you got to get here.
Yes. Put it on
But
your
you
list.
needed to
Especially if you're in
get
Atlanta. Ride on out or fly down. There's a lot to do. And Michelle has a company. She got a horse farm. She got a lot of
Yes.
stuff.
Yes.
No, I think that I can't begin to even just really just help people try to understand the magnitude of what Michelle has done. And you can only really, I mean, you can see it and I can talk about it, but to truly understand it, you've got to go. You've got to go in person and kind of make that pilgrimage down there and listen to her, let her take you to these spaces and these places,
Mm-hmm.
and help you understand, and then allow that to shape the way that people who are entrusted to heal move through the world
Mm-hmm.
because they've made that pilgrimage,
Mm-hmm.
and it shapes the way they show up for people because they
Absolutely.
understand in a way that check the box implicit bias training could ever help them understand.
Absolutely. Absolutely. And then not just drawing the lines back to infant mortality
Yeah.
and maternal health. I did not know. I'm new to the space. Like I'm just an infant myself, learning about what actually happens with the death of women and children, and just how impactful this racism and the systemic racism is in healthcare and in women's health. I had no idea until I started doing my research,
Yeah.
until I did a deeper dive on what's happening today. And we saw it also with Mercedes Wells,
Yes.
right? That's the latest, where she was also at the
Oh,
conference. She's talking about, yeah, about how she was turned away and the baby's head was right there. Y'all, it was so impactful. She gave us the 911 call and told me to play it. And by the time 5 minutes was up, we were all just we can't do this no more. And so, but it's all stemmed from Black people have a higher tolerance for pain, or that we experience pain differently. It's all of these lies, the system that J. Marion Sims and many of the doctors like him uh, put together, and they're still believing. These students are still believing. So that's why it's important for us to bring them to Montgomery, teach them the history, but also teach them how to be better practitioners, right? We want to erase this history because they're afraid that we're going to be better than those that came before us. So we're actually with this new cohort that we have. And I have a shirt for you, Charles, and a hoodie for you, Gabby, that talks about Dyer, right? And Dr. King talked about in his Birmingham, the letter in the Birmingham jail, where the world, the nation, and the South is in dire need of creative extremists. And this is the only way we're going to get out of this thing. We're going
mm,
to have to create policy,
mm,
right? We're going to have to do something to change the narrative and hopefully change the mind of these folks that are creating these laws, like the mommy bus, right? What is the holdup? What did we do? It's just simple. Just sign the bill. Get the folks the money, right? There has to be a behavior change, a behavioral change, a heart change in some respect. I know it sounds hokey, but it's not. In J. Marion Sims, in his memoir, he talks about how his father, he could never, receive the affection from his father that he longed for. This is in his memoir. And I see Donald Trump there. Can I say that? Yes, I can. I
Mhm.
see this behavior in this doctor, J. Marion Sims, who longed for the affection of his father, but his father did not want him to become a doctor. He talks about his Negroes, his Negresses. He talked about, he just belittled and degraded him. So when you come to the space now, you could read chapters of his words and what he said about Anarcha, how patients like this don't live, they deserve to die. And this is the same behavior that we're seeing in our healthcare system in maternal health. So it's a deep dive, right? And we want people to get in there and dig up the dirt.
Yeah.
Mhm. So that's my life's work right now. That's the mission. That's the goal.
Yeah. And you're so necessary. So, so, so necessary. And I know that's, we talk with specificity about everything that Michelle has done. And in the midst of all this, has decided she wants to host convenings on an annual basis for people from all over the world, right? Um, and every year it is absolutely amazing. And it gets bigger and it's better and it's more impactful. And somehow the following year she manages to pull it off and elevate it again. And then immediately now we're just conditioned to start looking towards next year as soon as the dang conference is over. Because what's she gonna do next? And
So funny.
so, but at the end of the day, each year we also have a conversation about Charles, this is my last one. This is my last one. Every year. And
Listen.
what I say to her is, okay, I hear you. And however you decide to move forward, I got your back. But you know the people need you, right? Like there's
Yeah,
nobody that can pull people together in the way that you do. These people go to conferences day in and day out,
they did.
on and off planes, sitting in ballrooms, eating lukewarm chicken.
Yeah, yeah, yeah.
It's business as usual. But when you come to your conference, it is such a it's transformative. And it's just from the energy to the way that it's curated. Um, it's something that only you can do. And that's the thing that I tell you every year. And then a couple of weeks later, I get another call. Okay, so this is what I'm thinking about for next year.
Trust me, I did that too. I did that
Every
this year.
time. And I just wait for the call. I wait for the call. And I'm excited whenever it comes. I
Well,
truly am.
I appreciate you letting me cry on your shoulder because you be like, Charles, I'm new to this thing. I don't think I want to do it no more. He be right there. Say, girl, go on. Right? You do.
like like
Yeah.
Charles, these people are people. I didn't know that these people in this space. These people really be people. And I'm
Yes.
like, yeah,
Yes. Yes.
yeah. And sometimes we're able to, and sometimes we have to, you know what I'm saying?
Right. Right.
But we just keep moving forward. And you know, it's an interesting journey. It really is.
It
Never a
is.
dull moment.
Well, and I'm grateful because I've learned so much. Right? You've been this is your 10th year, right? You all's 10th year in doing this, but I've learned so much in dealing with other people and what not to do. Like this year, I think I forgot to put doctor on somebody's name, and it was just like the straw that broke the camel's back, and I was like, I'm a screw up. I literally had a meltdown. I had a meltdown, but people thought I was joking. They thought it was a joke,
They thought it
and
was
it
they
became,
thought it was informative, and you
bruh.
couldn't even have your moment.
I
Because
did,
you're
and
such an
it was
artist. You
it,
couldn't have a moment.
bruh. I used to talking to horses, cows, and chickens. I'm a country girl. I didn't know nothing about this, but it became not only a way to cope, but it became funny, and it kind of eased, some of the pressure. But even in that, the message was you got to press through, right? And
Right,
everybody, it was a mate. So we have to press through these injustices, and we got to find a way out of this mess. This
right.
is a mess. right? I'm tired.
Yes.
And one of the things that I said at the conference, I'm tired of hearing the same, oh, Black women are 3 to 4 times likely to die. What are we doing? Just the other day, I saw VCU has a curriculum for Kira4Moms, right? You do know that they showed your curriculum?
Where'd they show it?
It was at the college. It was a curriculum that
See you.
talked.
Yeah.
Yeah, VCU.
Mhm.
So that's the type of work that we're looking at. So that helps me depress, right? It's not about us. It's not about our feelings and how tired we get, but who are we going to impact for the next generation to become better practitioners, politicians, whatever the case may be.
I couldn't agree more. And I think that that is one of the things too that um I don't, just like you, I don't like talking about it.
Yeah.
Right? You understand what I'm saying? I talk about it because it's when I'm called to and when it's necessary. But
Hmm.
what I mean about talking about it is that I'm just so much more determined to be around people that are actually doing something about it, because so many people talk about it.
Yes.
And this people that do the most talking about it, Michelle, are the ones that always have a problem for every solution.
Hmm. Hmm.
And you know, there's a lot of really, really, really brilliant people that have poured, their life's work into this. And even far before I was here. But um, sometimes I do feel strongly about the fact that so much of this is caught up in theory
Yeah.
versus, okay, but no, are we gonna do something, or are we gonna try and find somebody else that will listen to us talk about it?
Hmm. Absolutely. And it's interesting that you should say that too, because that's where Dyer comes from. The dignity, they want to dismantle DEI. Okay, well, fine. You've taken it, fine. So now we're in dire need, right? We're in dire need of dignity, integrity, respect, and empathy. But with that, how come we can't create our own dire league? So this year we went to the Negro League. There was a message throughout the whole conference, like the Negro League was a league of their own. These people are
Yes.
amazing baseball players. And there was a
Absolutely.
doctor. Yeah, there was a doctor that we honored. It was a black woman doctor that we honored whose father passed away, but she carried on the league, the
Sure.
baseball league. And so that's what the clarion call is for. How come we can't create our own league of practitioners, social workers, PAs, medical practice, whatever the case may be, so that we can call on them when our cries for help aren't listening, right? A.G. Gadsden. A.G. Gadsden was the first black millionaire in Birmingham, Alabama, that saw the need for insurance amongst black folks because white people
Mm.
didn't want to insure them.
Mhm.
So he
Yeah.
created his own, he became a millionaire. So how come we can't figure out a way to have a community healthcare system
Yeah.
that offers healthcare? We can do, they did it back then. And now they're erasing the history, right? They're reversing us back to the days of Jim Crow and before Jim Crow. So our people had homes and businesses and they were thriving in the midst of that.
Yeah.
How can we create a dire league where we can thrive in the midst of what's getting ready to hit us? Medicaid, healthcare, just access. The woman is in the 21st century. The head of her baby is at the tip and they send her home. This is dire. So again, that's why it's important that we have our own physicians, our own pool of physicians and OBGYNs and obstetrics and doulas and midwives that we can call on because this system is at the point now where they're not letting us in, period. So to learn the history and to know where we came from, which we've come, I think this is a remarkable time in our country right now because of the rollbacks, for us to shine as we do, to rise like the phoenix, right? So I digress. I yield the floor.
So obviously, and so that's some work you do. You bring in midwives and doulas, but you also give them a place of sanctuary and rest. What
Mhm.
and you do that for us, but then you also do the historical angle to teach. Like you said, you're bringing from all across the country, UCLA, Jefferson. How have you seen those changes when people learn that history?
Completely different. They weep. I was just in UCLA yesterday. As a matter of fact, the UCLA, the public health, they came here. The fielding public health, they came here first. They saw what we were doing here, and they said, "How can we get you out to UCLA?" Was there yesterday. The people were weeping. They were like, "We didn't know, right? We didn't know the richness, number one, of this history, and number two, that Black people were discarded to the point where they just snatched the wounds oftentimes. These folks were eating Black folks. They were taking their babies and using them for alligator bait. So why do you think that we're going to involve, right? So I have to bring it to them. And this is why the administration doesn't want you to know, or they don't want you to talk about justice. They don't want you to talk about reparations. They don't want you to talk about maternal health. That they'll take the mommy bus ad and add little things in there that's not quite right. You understand what I'm saying? Um, and so it's we have to hit it head on. We have to expose it for what it is. And I always say that these people are 20 steps while we're over here playing checkers. They're playing chess. We have to become chess players and know what the next move is, right? And so it's just interesting to see that now there's a group of folks in UCLA that now want to create curriculum for us and to come here and as fellows and help support the work to be a part of a dire league, to where we can write our own Hippocratic oath to do no harm, but also dignity, integrity, respect, and empathy. So I can go on, but it's a remarkable thing what's happening, and I'm just so grateful to see it. And so now that I'm taking a year off, my friend, because I decided to do it. We come back in 2028 because people were like, "What are we going to do now?" I decided to take a year off to focus on my own health.
Yes.
You know, because if we're empty, who are we pouring back
So
into?
true.
We have to, and my mental health is at stake because I cannot believe that we are sitting here allowing this man to get away with what he's getting away with, rolling back, the fact that these people not only can they get health care, but they can't even find a provider. Medicaid, you're pulling my parents, their money is at stake. Their Medicaid and Medicare recipients, and now their money is being shortened. Thank God the children can pick up the slack, but um, what are we gonna do? What are we gonna do? We need to play chess because they're playing it already. They already know what the next move is. So our next goal, 2028, we will open up our own healthcare or our own health care facility. We did some of the unveiling this year, and people were able to come here and see the space. So we're not going to wait. It's the year of the Panther. You do know the Black Panthers. 60th anniversary is this year. They opened up their own clinics to take care of their people, feeding programs, healthcare clinics. So we're going back that way. We have to.
Very true.
Hmm.
It is.
So
And I think that you make a powerful point that I think that the illusion that everything is okay is very powerful. But once that illusion is gone, what happens, right? We really understand things.
right.
Um, but think that people just so desensitized. Like, it's like, oh, this, oh, oh,
Hmm.
like almost like watching this thing, almost like it was gamified or something. Oh yeah, he did this. Sure, why not?
Mm-hmm.
Why didn't he tip off his sons to $100 million when he tweeted about, you know, ending civilization?
Mm-hmm.
And
Mm-hmm.
why isn't he going to tell him, you know, why wouldn't he go ahead and take 50 million in the other direction when he told him, no, I think we got a deal for a ceasefire? Just
Mm-hmm.
going right up and
Mm-hmm.
down, up and down, up and down, up and
Mm-hmm.
down, while pissing the rest of y'all's life was crazy.
Mm-hmm.
And then the thing now, I think this is really interesting, is that you're just really seeing people beginning to see things for what they are and really roll back their perspective. Like, I can't believe it. He's this. Like, y'all, put him there. This is what we
Right.
talk.
Right.
People told
Right.
y'all. People
Right.
told y'all. But no, wanted to make America great.
Mm-hmm. Yeah. And let's keep their head on a swivel. There's no rest for us. We're just like, you know, okay, okay, you know, um, but we have to play chess. We have to play chess. They're back to the old playbook, right? We saw that with Jasmine Crockett. Right, they'll write you out your own district. You know what I'm saying? Like this. So okay, so where how can we get back to drawing our own lines? Right. I think that, and can I just say this? And I don't want to go off into a tangent, but I sometimes, not sometimes, but integration is one of the things that killed us.
Mm.
It killed the economy, killed the fact that we had our own doctors and nurses and educators that took pride in educating our children. Um, we had our own infirmaries after the Civil War. You know, we had the Freedmen's Bureau that formed. Government had its hand in that, but then you started having these infirmaries that were popping up, and black babies were thriving. Midwives were doing the work of making sure that babies were coming here without a cesarean and without, you know, injury and harm. So what did they do? They said it was dirty. It's a dirty birth. It's not clean. So they demonize. So this is something that it's been happening. So when do we play chess? Get ahead of it. Um, so anyway, I digress. I yield the floor. I don't want to go that far off, but it's about maternal health, right? But in order to have a healthy birth or just a healthy knowledge of it, we have to know the history and how it was corrupted and colonized. And so, what you all didn't get a chance to see also is that we're opening up our facility for the interpretive center for the Mothers of Gynecology Monument Park. It's a
Mm.
beautiful
Mm.
installation, all three rooms. It's just
Mm.
absolutely beautiful, and people were able to get a glimpse of it, where we're talking about, you know, squats, you know, different positions and herbs that you
Yeah.
can as a new mother in the continent, you know, on the continent of Africa. And so we have a Ugandan, we have who talks about the fistulas that Black girls and women are still suffering from to this day. And then we have another woman who's from Ghana, and she talks about the teas and the herbs and the coconut soup that they would. So, you know, there's the education
Got you.
going on in this space now on the grounds that talks about how to live and nurture community and how women would sing and chant and you know, sing these hymnals and in order to make sure the mother is taken care of, not just the baby, right? Then in another room, we have the doulas and the midwives, and we honored Nakia Grayson and Dr. Stephanie Mitchell and all of the other, Aurelia Browder. My auntie was a midwife, also one of the pioneers of the civil rights movement. We honor her in this space, and we talk about these midwives and midwifery and the granny, you know, um, and the doctors that evolved even from the, hey,
Hi. How does it feel to be 10?
Good.
Happy belated birthday.
so
Thank
hang.
you.
You gotta come back and ride the horses. This is the one that rode the horse.
Mm-hmm.
Mm-hmm.
Uh-huh.
This is the animal lover. Like, he all day. Think, look, man, everything. Never met. Yeah, exactly. The Western Alabama. Exactly. See,
Remember.
exactly.
Can I have some over there?
Well, I need this. Wait.
Okay.
All right, I'll see you in a minute.
Bye, Daddy.
All right, wait. See you in a minute.
And for everybody who may not know, that is the one and only Langston. Uh,
Thank you.
You said never go.
Wonderful, wonderful voice.
Thank
yes,
you.
Mm,
Thank you. Thank you. Thank you.
yes,
Thank you. That's the ultimate compliment. Truly is.
just wonderful. You're raising men. It's amazing.
Thank you.
Love that.
Thank you. Thank you. Thank you. I don't know. Sometimes I feel like they're raising me. But hey, figure it all out. Um, but no, I'm grateful. So Michelle, what are we gonna do together next?
Hmm.
What are
Well,
we going? What is we gonna do? What should we do? Do emphasis on do together.
I know we talked about curriculum in the past.
Hmm.
This week we have 10 in the fall. This is just the kickoff of our program, of our
Okay.
cohort. But we have 20 that's coming, OBGYNs that are coming to Montgomery in the fall. So we're
Mm.
looking for professors. We're looking for people that can um, teach a curriculum. Dr. Maybank has created one for us along with Dr. Emily Cleveland.
Okay.
Created a beautiful um, partner with us and created the medical portion of what we're going to be teaching along with the
Okay.
historical portion. And then, of course,
Gotcha.
so yeah, that would be something wonderful that we can do. And then we're also opening, and this is the first, our own space for birthing. We're opening up a birthing
Yeah.
center, and Dr. Stephanie Mitchell is going to be helping us with that. Already bought the building, and so it would be wonderful for us to continue our talks on. Um, how you come to the conference and you update us on policy and what we need to do in that drive because it's so very important to change the policy and the narrative around birth equity.
Yeah.
And you got to do it through the law, right? So listen, I'm whatever you want to do, I'm down.
Okay.
I'm
well,
down.
it sounds like definitely the getting your curriculum or getting our curriculum to you for the fall. So I will follow up
Yeah, the
on
one for
what
VCU,
those
right?
dates. Yeah, that's our POGL. So we
Oh,
can integrate that. That's just say no more. Um,
amazing.
and then yeah, with the birthing center, we love to talk about 4Kira for dads and how we make sure we're elevating the role of the village and the man so that they can truly play their part in that birth.
Absolutely. And I welcome you all to be a part of the conference in 2028 as well with your own curated space and how you would want to create the space. We're going to Tuskegee. We're going to do Tuskegee and Montgomery,
Okay.
Okay.
which is full of farmland, right? So that's another preventative care, nurturing through food, right? A lot of what we're going through now with hypertension and
Hmm.
postpartum care is that it's the food that's killing us. It's processed, right?
Yep.
So
Yeah.
what are we doing? How can we get ahead of that? So I would love for you all to be a part of that as well, Charles. And even if you wanted to bring some of your brothers, I watched the dad games the other day, and how fun it was, but also it built camaraderie. Like the brother,
Absolutely.
we need to see our fathers. I'm a daddy's girl. Like
Yeah.
I love my dad. I got to be underneath him all the time with his 85-year-old self. But it was just wonderful to see the heads of the household in that respect. The brothers changing those babies' diapers out
Yeah.
there. It was just
Then
amazing.
taking pride in it is the cool part.
Yes.
Yes,
That's the
it's
coolest part for
beautiful.
me is just like when you see the like, yo, like let me like I get busy, like yo, like I'm in this. Like no,
Yeah.
you thought you do this. No, let me. I do this. Like no, step back.
Well,
And the
you know
same
the
way that you
winner.
compete in anything
You
else. Like yo,
and you know the winner this time had competed back at Baby Palooza, so he came back like I'm gonna do this. So we have a new winner, and we got Aaron. Like we gonna have these games and these competitions, because like you said, the pride in it, and that's what we
Oh,
have to celebrate, um, and especially show to the next generation. Like it's
absolutely.
that education part where you know. Charles, your story is education for these young brothers
Mhm.
because the world will tell them, like the game or Nelly, that I ain't changing no diaper and I don't need to do. And we've got to change that narrative because we need you to change the diaper, not
Mm,
only for them, for you, for
mm.
her, for the family.
That's
So
that's
yeah.
right. Love it. I love it. Yep.
No, definitely. Well, Charles, I can't see on my screen because I don't know. But are there any questions from
Um, does
those with
anybody?
us?
Yeah, does anybody have any questions? We
Yes.
look. We told Michelle we was only going to need a half hour of her time, and look, we was working to the bone.
Oh, I'm sorry.
Oh,
No,
that's all right.
you're fine. I'm just saying you have been such an amazing someone asked you, do we just need a second of your time? And then I got you here just but I really hope that people learned so much tonight. I hope that people had an opportunity to either whether you were familiar or you thought you understood. I don't think there's any way that even before this evening, even myself, every time I have these conversations with Michelle and my understanding of the way she sees this world and the way she sees her impact and the way she sees her artistry and the story of the mothers moving through this, it's really amazing to see. Um, it's really amazing to see. And
Thank
let's
you.
always look forward to our next conversation.
Absolutely. We must plot.
Yes.
Gotta plot.
For sure.
Yeah.
For sure, for sure. Does anybody? So I'm gonna check one more time. See if there's anybody. Does anybody have any questions? Thanks so much. A lot of thank yous, a lot of love. How can I join this amazing community? Gabby can speak to that to see. Um,
Yep. Follow us, DM us that you want to join the village, and we'll get you over our mailing list. And if you want to even go further than that, we now have a curated community for advocates, influencers,
mm,
celebrities, whoever wants to get more information and share and spread the
so
voice. We always take donations. We're always looking for volunteers. So info at 4Kira4Moms.com. I can put that in the chat that you can always email us directly. And like I said, follow us on all social media.
The village. And y'all gonna make my juices come alive. The village.
Well, we talk about that history, right? We got to bring back the village experience.
That's it. Right on. I love it.
Have who's protecting, who's watching, who's
It
helping, who's educating, all
that's
of those things. That's that part. And so that's our piece
yes.
of the advocacy piece, because those
Yes.
that we can control education, we can control advocacy while we are trying to shut down and change legislation. But we each can control what we know, what we
Yes.
teach, and who we help.
and so Gabby, I'm not sure if you can see these on your side or it's just me, but this Invisible Footprints was saying that she met Miss Gabby at Senator Lamar London's.
Oh
Sorry
yes,
about that. Yep. Yep, yep, yep,
Tennessee.
yep, yep. Another question is,
Okay.
interestingly enough, how can we share this? How can we share this with the homeschool community? Um,
Ooh.
Homeschool
Mm,
groups for the Black community. That's a very, very interesting topic.
mm, mm,
Maybe Michelle, you can maybe speak to quickly how they can connect with resources through you all, and then of course we can let them know how to contact us.
mm. Well, we have the homeschool community here in Montgomery is rooted in our horse farm. So we make space for them and their families. Um, but when you're talking about a village, that is the key. Creating the space for the because we have homeschoolers right now that work with us. They were all at the conference. They were all
Yeah,
the homeschoolers and the moms and whatnot. Put them to work in the whatever you're doing, creating space for them whether it's getting the word out, whether it's showing up at events, whether it's, you know, that's Atlanta. There's so much to do, but those young people, especially during the summer, it's a prime time to utilize that village with the homeschoolers. Yeah. Mm, yeah.
Okay.
Mhm.
What else? Okay. A lot of people saying thank
And
you.
and then Michelle,
Mhm.
how did they get in contact with you? I mean, of course,
Oh.
Mothers of Gynecology, but website,
Hmm.
email, anything like that?
If they Google the Mothers of Gynecology, it pops up anarchalucybetsy.org. And we're going to be changing that website pretty soon because the name is too long. But right now, just Google Mothers of Gynecology and we'll pop up. And there's ways that they can be a part of our events. We're getting ready to move into a new arena with some of the things that we're doing. So, but always looking for folks to come and bring their homeschoolers, learn this history. We have space for people to sleep now. If you need a place to lay your head and bring your kids, and maybe maybe you can't afford it, so we have affordable overnight stays for folks. If you just want to give your children a rich experience, you can do that as well. But yeah, so anarchalucybetsy.org and or the Mothers of Gynecology.
Mhm.
Yeah, come through.
Come through.
Take a trip to
Um,
Montgomery.
take
Yeah,
a trip. So I can't thank you enough for spending this time with us during Black Maternal Health Week. And we're just grateful for you just being who you are, just always sharing, being a connector, being a friend and supporter. We're just grateful for you.
thank you.
Grateful, grateful, grateful.
I appreciate you all. Thank you for having me.
And thank you for coming with us, celebrating Black Maternal Health Week, and just for doing what you're doing. You taking, like you said, Dyer, you are leading that charge. And what creativity does in the space of education and history is it breaks down those walls that data cannot do. And so thank you for helping to tell the stories of our ancestors, of Kira, of those that we've lost, of those who are here,
Yeah.
because the stories are what changes. That's what resonates.
Hmm.
Um, and it's truly part of this movement. It's an integral part of this movement, and we can't do it without you.
Thank you. I received that too. Much love to both of you all, and you all need to get some rest too. You need to lay down. And we too.
Yes. Yes. So
Yep.
thank y'all so
Thank
much,
you
ladies. Thank you everybody for
so
joining
much.
us. All right.
All right.
See you next time.
Bye.
Bye.